Hi guys, Dr. Pat here, and today I'm going to show you guys how to get rid of your low back pain fast with my 5 absolute best exercises. These are exercises which I have used in the clinic to help patients get rid of their low back pain, and I hope they give you relief from your low back pain as well. If you are new to my channel, please hit the like and subscribe button below. I do my best in every video to give you guys the best content that I can to help you out. Thank you for joining me on this journey, and let's get to it. Here are my 5 absolute best exercises to help you get rid of your low back pain.
Alright guys, for this first exercise, what we're looking to do is just to decompress the back. You can do this by gently pulling your knees to your chest just like this, using your hand underneath for support. Hold this, what I recommend, try for 20 to 30 seconds. If you feel comfortable, you could take breaks in between. Now, some people aren't able to tolerate this position, so what you could do instead is, if you have a physio ball just like myself here, you can rest your legs on top of the ball. This will help take pressure off your low back. Some people find this very comfortable. If you don't have a ball like this, you can use a chair, or you can use a stack of pillows as well. As you see in the video here, I'm going to grab a stack of pillows and we're going to try this out. I recommend 3 pillows, good enough height, make them nice and soft. And all you have to do is rest your legs right on top of them. If you feel very comfortable in this position, you can rest for as long as 2 minutes, 3 minutes, 4. You can rest as long as you want. I just wouldn't go over 10 minutes resting in this position. The goal for right now is to decompress our lower spine to give you comfort so that you're able to do the exercises that are following. Alright guys, this next exercise is called lower trunk rotations. I want you to lie flat with your feet flat on the floor, a few inches apart. Now what I want you to do is gently swing your knees to the right and to the left, only in pain-free ranges. You're going to do this in a nice and slow movement pattern. If you're swinging your knees to one direction, you start feeling pain in one spot, I want you to stop and then swing them gently and slowly to the other side. I do not want you to push through any pain during these exercises. I recommend to my patients about 3 sets of 10 of these exercises. You can do them 2 to 3 times a day. The goal of this exercise is to improve your lower back flexibility, regain some pain-free range of motion, and help get your blood flowing in your lower spine. It's a nice and gentle exercise, and I want you to breathe throughout, in through your nose and out through your mouth. Do not hold your breath for any of these exercises. Thank you. We're about to move into the next exercise. Exercise number 3. For this next exercise, I recommend you grab a small towel. This exercise is called posterior pelvic tilt. The posterior pelvic tilt exercise was studied in a 2004 publication in the Journal of Athletic Training, where researchers examined its effect on core abdominal muscle activation versus a popular exercise called abdominal hallowing or TA activation, which will be shown next. The researchers discovered that the posterior pelvic tilt exercise did a greater job of recruiting rectus abdominis and external oblique muscles in 26 healthy female college students in 3 different positions here. This study shows that if your goal is to improve overall core muscle activity and strength, the posterior pelvic tilt exercise is the better exercise to perform. To perform the posterior pelvic tilt exercise, simply take your small towel and place it underneath the small curve of your lower spine. Once the towel is resting there, a good cue I like to give to patients is try to flatten your lower back into the towel, hold for 30 seconds, and then relax. The motion looks like a twisting motion, as you see me here, just twisting back into the towel and then relax. Tilting back could also be another cue. Tilt back into the towel, then relax. It's important to remember, do not lift your butt off the floor during this exercise. If this exercise feels painful, please stop. As indicated in the study, it does increase muscle activation, so some patients may find this painful or uncomfortable and others do not. For those that find it uncomfortable, I have a variation to this exercise, shown here next. The alternative to the posterior pelvic tilt exercise is transverse abdominis activation or abdominal hallowing, as shown in the previous study. For this exercise, I like to tell my patients, put your index finger over your belly button. Now, attempt to draw your belly button in towards your spine and hold it there for about 6 seconds. Then relax. Do not try to hold your breath. Just simply pull your belly button in and hold your belly button in for 6 seconds. It's very important that you do not suck in your whole stomach. If you were to suck in your stomach, you're activating the rectus abdominis muscle. That's not the muscle we want. The muscle you're activating by gently pulling in slightly your belly button and holding it is transverse abdominis, as you see illustrated in this image here. This muscle is very important because it wraps around your lower back and it gives stabilizing support to your lower spine. For this next exercise, we're going to be on all fours, hands under the shoulders and knees under the hips. Now this exercise, it's called cat-camel stretch. What you're going to do is arch your spine up and breathe in, hold for 3 seconds, and then arch your spine down and breathe out for 3 seconds. It's hold in on the way up, 1, 2, 3, and breathe out on the way down for 1, 2, 3. I recommend breathing in through your nose on the way up for 1, 2, 3, and breathing out through your mouth for 1, 2, 3 on the way down. Notice as my butt stays right over my knees, my hips stay over my knees. I'm not arching my butt back or forward. I'm trying to maintain this four-legged position, hands under the shoulders and knees right under the hips. And this is a nice and gentle movement pattern. Again, if you feel any pain in a certain range, do not push past that range. Stay within the pain-free range and keep it nice and gentle and pain-free. I recommend about 3 sets of 10 of this exercise, or you can do 3 sets of 8 if that's more comfortable. Usually by the 3rd set it feels better. I also recommend to my patients when I see them, I recommend about 2 times a day, 3 times a day. This is a good exercise to do before bed as well, as this is one of my favorite low back stretches. If you are enjoying the content of this video, please take a second to hit the like or subscribe button below, as this greatly helps my channel, and I really appreciate your support. Now we're about to move into my favorite low back pain exercise. This 5th and final exercise is called the prone press up. In a 2016 randomized control trial published in the Journal of Clinical and Diagnostic Research, examiners looked to study the effects of performing prone press-ups as shown in this video versus receiving posterior to anterior spinal mobilization, a manual-therapy technique you would get when seeing a physical therapist. There were 40 participants in this study between the ages of 18 to 45 with non-specific low back pain. The researchers concluded that receiving posterior to anterior spinal mobilizations from a physical therapist was the superior intervention due to its greater improvement in lumbar extension, but participants performing just prone press-ups did demonstrate significant reduction in low back pain scores and did have improvement in lumbar extension as well as improved functional scores. For this exercise, we are going to show you 3 different variations to find the one that feels most comfortable for you. For me, it involves having my hands a little forward. You're going to lie flat on the floor, and then you're going to extend your elbows straight until your elbows are completely straight and your chest is off the mat or floor, and your hips are flat on the table. You want to maintain your hips flat on the floor the entire time. Now, there are different variations. If that first version felt uncomfortable, try on just coming up on your forearms, just like this. Make sure your hips are not coming off the floor as you do this, as this is not a push-up. Some patients find this position more comfortable. I typically recommend about 2 sets of 10 of this exercise. What I do is breathe in as I'm on the floor, and then I breathe out through my mouth on the way up. Hold for about 2 to 3 seconds each position. Breathe in and exhale out through your mouth on the way up. This should be a nice gentle exercise. You don't want it to be painful. Now the correct way to do this exercise is with your hands under your shoulders. But as you can see, as I do that, my hips come off the floor, and this is not how you want to do it. So if you also lack the flexibility, such as myself, you want to have your hands a little forward. And then as you progress and get better over time and your flexibility improves, you could bring your hands back to underneath your shoulder. Or if the forearm position felt more comfortable for you, feel free to do that position instead. Again, I recommend 2 sets of 10 of this exercise. Only do it in the pain-free ranges. I'm going to show you here how I complete a full set of 10, taking into consideration my flexibility, so that you can see for yourself how a full set is completed. Again, notice as my legs and hips stay flat on the floor as best as they can. And I'm breathing in on the floor and then breathing out through my mouth on the way up, holding each for about a quick 2 to 3 seconds. I wanted to include just a quick tip at the end of this video. Watch what I do when I get up from the floor. You will see very shortly, this is called the log roll technique. Instead of forcing yourself up from the floor by lifting from your chest, I want you to gently roll to your side, just like I do in this demonstration here. What you want to do is roll to your side like a log and push up with your arms and legs to help you get up from the floor. Feel free to repeat and watch this a few times over.
Hey guys, I hope these exercises help get rid of your low back pain or give you some relief to your low back pain. If there's one exercise that helped you out the most, please comment below which one it was so that it can help others try it out as well, and it also can help me know which ones work best for you guys. If there's any future videos that you would like me to address, please let me know below as well. I would love to make content that's relevant to you guys, to my subscribers, and draw my ideas from there. Thank you once again. If you haven't done so already, please hit the like and subscribe button to give me more support and help my channel grow. So